Welcome to Caldwell County Today. I'm Paige Counts, Public Information Officer for Caldwell County. Joining me today are Britt Abernathy and Lisa Cavanis from AMOREM. Welcome, ladies.
Thank you, Paige. It's great to be here.
It's great to have you, and we're going to talk about something that I don't know that we have ever talked about with AMOREM.
I don't think so.
And that's staffing. Britt, your title is Director of Culture and Talent. What does that mean?
That's correct. So we use the term culture and talent because that's exactly what we want. We are setting that tone for a positive, wonderful culture, as well as we're looking for talented people to come in and looking for our talent. And so culture and talent basically is human resources. Sometimes human resources has a little bit of a negative connotation. You know, there's so many social media posts and TikToks that are funny talking about, oh, I've done this, I'm going to human resources. But we are so much more than that. It really is that development of that culture and looking for the talent to come in.
And Lisa, you have we're here in Caldwell County, we're used to just I don't want to say little because it's never, I mean, it started small, but in the recent years it's grown quite a bit. We're used to just Caldwell Hospice and Palliative Care. So talk to me about what has changed in the last year.
Well, a lot has changed and a lot has stayed the same. Caldwell Hospice has been around since 1982, and so has Burke Hospice and Palliative Care. And back in around 2019, 2020, we started talking together about the possibility and the advantages of merging together into one organization. It created more resources, and we felt like we could serve our communities better. And we already overlapped because we're neighbors. So we joined together and officially became one nonprofit hospice and palliative care provider in May of 2021, and we rebranded as AMOREM. And it's the same local hospice providers, same local people serving the same geographic areas, but we have more resources. We're with a bigger team to serve our community.
Talk to me a little bit, this is kind of an aside. Here we are very familiar with the nonprofit hospice world. Talk to me a little bit about what's different between the nonprofit and the for-profit.
I would love to. And a lot of people, especially if you're from this area, think all hospices are nonprofit because ours is. But that has been changing over the years. More and more hospices are for-profit. And I'm not saying that a for-profit hospice doesn't care for their patients, because you couldn't do this kind of work and not care for the patients. But we operate under a different business model, and a for-profit has to show a profit, and they're trying to make money. And so there are certain guidelines Medicare has that you have to do these things as a hospice, and they're going to do those things and not much more because that's going to cut into their profits. And as a not-for-profit, we still try to be good stewards of our resources, but we put that money back into the program, and we provide a lot of services without reimbursement because we believe it improves the quality of life. The last fiscal year we provided $2.1 million in care that was not reimbursed, and that we were able to do that because of community support and grants, and because of our business model, because that's our goal is not to make a profit, it's to make quality of life better.
And I like to add too, one of the differences in the not-for-profit and the profit is we have our patient care units. And you know, people sometimes think that is the hospice, that patient care unit, because that's what they see. They call it the hospice house, and it is a home environment. We want it to feel like that. But honestly, it's a skilled functioning unit, and those are the ones that really only a small percentage of our population will ever see that unit. It's for particular regulations, and they can come, but that's one of the things that we are proud to offer is our patient care units for our patients who want to come to our unit for their last days.
And that's very much a nonprofit benefit because they're not revenue inducing there. So for-profits generally don't have a patient care unit.
And we are so blessed because here in Caldwell County we've had one for I don't even know how long. It just seems like it's always been there. And I know that's not true, but, we've had that for a long time.
And to have 2 and then now 3 with Valdez, that's really very special.
And Caldwell County was the first patient care unit in North Carolina, not only in the county but in North Carolina. So that is something we're quite proud of.
So, but behind all of the services are the people. Tell us what kind of roles you have at hospice. I know it's a wide variety.
Absolutely. So one of the great pleasures and just the strength of our hospice is our team, and we work as a team. And so some of those members of those teams are obviously the registered nurses, and we have 2 different types of registered nurses. We have the registered nurses that go see our home care, which again is the majority of our patients. Then we have our registered nurses that serve our patient care units, and of course that's 24/7. So that we have first shift and a second shift for that, and they're there for any needs. We also have our own call nurses that are 24/7. So once our home care nurses that work from like 8 to 5, sometimes longer, then our own call nurses will take any calls for any emergencies during the middle of the night or any needs during the night. So those are our nurses that probably the bulk of the employees that go see our patients. They see them once a week, or definitely as needs arise. And of course our own call goes out and sees them when needs arise and stationed in our patient care unit. The other part of our team is our medical social workers, and they are so important for that support to those families, for just being there during this journey, during this hard time, as well as helping them with any kind of financial things that they've not thought about, helping them with some advanced planning. Some people just don't simply think about that or have the conversations with their people that need to know what their wishes are going to be. And so they work very closely with our registered nurses. Sometimes they do joint visits and they go out. So we have our medical social workers. Then I have to proudly say that we have the best nursing assistants that healthcare offers. Our certified nursing assistants is a choice for our family. You can choose to have one or not. But they go out and provide personal care for our families, and just that additional, that emotional support that is needed. We have our medical director who is overarching all of our regulations and looking at our policies and procedures and certifying our patients and making sure that they are hospice appropriate, which you do have to be eligible for hospice. And they also work with our palliative care department. We have our palliative care department and all the nurse practitioners and the support staff that work with that. We have our chaplains, which are amazing. And so our chaplains are part of our teams that sometimes people don't take advantage of, and we would love to increase that, because it is about meeting you wherever you are emotionally. And so some people have the misconception it is about a particular religion, but it's not. It's anything spiritual or any kind of emotional needs that you may need. We have some excellent chaplains that are involved in our team. Then, of course, we have tons and tons of admin staff, and any positions that I've forgotten, our physicians that look at our patients that are in our medical units and offer support with writing scripts and any treatments that orders that our nurses need. Our support staff, going from the admin staff as well as our maintenance staff, our custodian staff, our fleet car staff, our billing department, of course, is a huge asset, and we have a fantastic billing department. And then we have our senior leadership team, which is our administrators that kind of help support all of that. And so just one big, huge team.
What roles do you need? Where are the most vacancies?
Okay, so along with almost everybody else in healthcare, we are in a little bit of a nursing shortage, and it's misery loves company, so to speak, and so it's not as alarming that it would have been if everybody's not experiencing that. And it's really not even healthcare either. It's across the board. Everybody has needs for employees. So we are looking for nurses right now. We have about 15 vacancies. Several of those are already in progress to be filled, but we have about 6 or 7 that we're looking for to be filled. And that is with our access enrollment team, which would be that very initial enrollment to hospice that comes and explains to you what hospice means and gets the paperwork signed and supportive and tells you all about the program and what you can expect. As well as we have our home care, care, which is a big need right now, and that's those nurses, those frontline boots on the ground nurses that work in the rain and the snow and the heat and all types of environments, and so they do it for the mission. But it can be daunting, right? And so we're looking for those to go in and see our patients when they have a need, as well as to be their support throughout that journey. We have some medical social worker spots open, and so that would be, of course, that social worker that goes and supports that family throughout the journey. We have a director of HR position that was open, and that would be my position. And that is a very important position currently. And the reason why I'm transitioning is because I'm a registered nurse, and my heart and my passion is in education and supporting people in engagement and things like that. So I'm looking to go back into that because that's really what I think I excel in. So that would leave a spot for that director of HR or director of culture and talent. And so we're looking for somebody that has experience, who understands HR requirements, HR laws, understands health care HR also. We have a physician opening, and we also have a medical director opening. So we're looking for, passionate physicians that are there because of our mission, and that are good stewards of people's resources and finances, as well as understands the regulatory components of hospice, because that is important. When I first came to hospice, I was honored to be asked to come to hospice, because that is where the angels work, right? Everybody walked around and everything was just wonderful. That's the best people, and they are the best people because of what they do. However, there are a lot of regulations and a lot of rules and a lot of things that you have to follow in hospice. And so, we're looking for people that can quickly understand that and to follow that, to make sure that we're online so that we can provide the best quality.
One of the things you mentioned that's your passion is education. How important is that education from the nurse to the family, or the social worker to the family?
Oh, absolutely. It is vital. And it saves a lot of time too, just with worry and with calls in general. So we have a survey called the CAPS, and it's a survey that goes out to any hospice, and it asks certain questions. And one of the things it talks about is training. And so as a nurse, you are taught education. And so you document, I educated the patient. But we say training, and that's exactly what it is. It's not just educating somebody, it's training them to either take care of their loved one in this time that is very different than what they were used to, and probably nothing they've never ever expected. And so we do a lot of training, and that means we tell them the information, as well as ask them to feed it back or ask them to review it. We have a wonderful caregiver guide that has like the different phases and then some of the things that signs and symptoms maybe you can kind of expect, and so it gives you a guide to kind of look at that journey a little bit. And so we use that, as well as lots of education over the phone of medicines. We always talk about the signs and symptoms of the medicines. That could be vastly different, especially a caregiver in that home will be the one that is administering most of those medicines, and so we make sure that they know the difference between 0.5 and 5. And so that training, that education piece is vital. Our social workers talk a lot about that financial piece, that advanced directive piece, do a lot of training on that. And we do a lot of community training. We have excellent, our community engagement team is so fantastic. They go out and talk to our physicians as well as our community. And then our bereavement, our grief support department, they do a lot of training after. Sometimes can be involved before, but they do a lot of training about what is normal for after a loved one has passed, and help them through some of those expectations.
I'm going to ask both of you this. Hospice deals with death and dying, so is it sad?
Sometimes it is sad, because you go to care for these people that we're helping take care of, but when you see the difference that it makes in their lives, and how much easier it can make the journey, and letting them know that they're not alone and walking along there with them, it's so worth it. That's why we keep doing it.
Absolutely. That's an excellent question. And I have to be honest, it can be very, very sad. Our team members get so attached to these patients, even if it's only for days that they were with them. But it is so important for us to continue with that mission. And what makes you fulfilled, even though you are sad because, someone that you loved or cared for will no longer be with you, you are so fulfilled knowing that you had something to do with that and that you made those times that they were here better. As well as what makes it a little easier too is that we have that family. It's very family-centered care. And so, yes, the patient is the top priority. However, that family is the ones that are left behind. And so we focus a lot on that family, and knowing that we're there still for that family after helps it be a little bit better and helps you to manage it. But the mission is what drives all of our team members.
And I have another question for both of you. What drew you to hospice? Because I don't feel like it's a job is the answer to that question. So what helped you to get there?
Okay, so so I am a Christian and I pray a lot, and I was doing pediatrics all of my nursing career. Okay, that's all I knew. That was my expertise. I never ever thought about hospice. And so I love to tell the story. I have a crazy border collie who quite often gets in between my legs when we walk up and down the road. You have to give him a lot of exercise. And so I had reached a pinnacle point where I was not going to be a nurse anymore. I was going to go try to do something else, maybe in the religious sector. I don't know. I was there. I was listening to a very particular song that moved me, and my border collie got in between my legs. And so made the song kind of skip a little bit, and it went to a verse that talked about going outside of your borders. And so that prayer was, I need you to let me know where I'm supposed to be. Am I still supposed to be a nurse, or am I supposed to do something different? That next day, I had a previous supervisor call and say, I would like you to consider coming to hospice and being one of our nurse team leaders. And I said, oh, absolutely not. I said, I don't know hospice and I don't know adults. So I was very nervous. And she said, well, you can learn that. Hospice is about heart. And you have the biggest heart that I know. And so I think your positivity and your heart would be a focus here. So I landed at hospice as a green team leader and fell in love with it. When I would go and shadow the nurses and see how much support that they gave and how hard they worked, and then that team, when I met the teams that were surrounded and helping, and then the entire organization, no matter what you did in the organization, your job was so important for those patients. I fell in love with it, and I decided, man, I wished I'd have been a hospice nurse all of my life. So hospice really is not a job, it's a career. And so, when we're looking at recruiting, that's one of the things that we ask people. We want to make sure that they understand that, this is just not an 8 to 5 for you or a shift job for you. You are there because you want to do the mission and you want to love on our patients. You do get a lot more time at the bedside, and that's one of our biggest perks, I think. And sometimes the reasons why nurses have burnout is because of the turnaround. And so that's a wonderful thing that you do get to spend quality time with our patients, talking to them, getting to know them and their families. So that's why hospice for me right now is because I was placed here on purpose, and it was because of my heart and for loving people.
Well, I never intended to end up at hospice either. I was a design major in college and worked in ad agencies and had started in marketing departments and had started freelancing and just working for myself. But my experience through that was mostly ministry-based clients or healthcare-based clients, like hospitals and health insurance and those kind of things. And when I was just researching for clients, I ended up doing called a nonprofit hospice. It wasn't called well, but it was another one in the area. And they said, well, we're looking for a public relations and marketing coordinator, and we'll save your information for that person when we get that filled, and they may be interested. I said, well, tell me about that. And so I ended up being their public relations and marketing coordinator. And it was a part-time position, so it worked well with my freelance clients. And at first, I didn't know if I could do it because it just brought up so many emotions. But the longer I was there, I started seeing what a huge difference it makes in people's lives. And I was hooked. And I was there for 4 or 5 years, and then the position at Caldwell came open. And so that's where I've been now for almost 12 years. And it is a calling, and keeps me coming back every day.
And you'll find too, our housekeepers and our dietitians and our dietary staff and, all of those people that you don't normally think of hospice. You think of nurses usually and social workers or doctors. They are such a vital part of our team and what they do. And they too are here for the mission, providing a beautiful, clean space for our patients and families and providing a warm meal. And so it truly is just a huge team that works together.
How does someone apply to hospice?
Okay, so we have a job application. We do recruiting on Indeed and Job Target. Of course, you can find it on our AMOREM website, and it take you the link straight to that. And so it'll give you a job description, kind of tell you, so you'll kind of know a little bit about what's going on, and then you will apply. And then someone like me will go through it and look at it and give you a call. You'll come in for initial, probably we'll talk about on the phone, and then you'll come in for an initial interview, and then we'll do another interview with the rest of the team or some team members, some different disciplines, just to make sure, even if you're RN, we would want the social worker to come in and kind of talk about that. We try to give you a really comprehensive day-to-day and tell you what I like to say, the good, the bad, and the ugly, so that you make an informed decision. But you're going to start there. It's in either Indeed or our website or Job Target, filling out an application and sending us your resume.
Awesome. Ladies, what have we forgotten to cover? What have we missed today?
No, I would just like to say, really consider, if you've never thought about hospice, just like me, I never thought that this is where I would be. Please consider us. Go to our website. It tells you our mission, which is to provide quality, thoughtful, loving care to our patients and support to their families, and education and grief support to the communities that we serve. We do serve 12 communities, so we are around a lot, and we have a huge impact. So just, it's a different type of health care. If you're looking for autonomy and flexibility, if you are looking for support from your leaders and the ability to really give back to a family and to go home at the end of the day, a little stressed because it could have been crazy, but knowing, oh my goodness, I have made such a difference, then consider us. Even if it's not the right time for you, give us a call. One of our leaders will talk to you about the job position you might be interested or qualified for, and we can go from there.
And we've both talked a lot about how it makes a difference in the lives of patients and families, which is very true. But just as much, it makes a difference in you, and that's important too.
Yeah, absolutely. If you're a nurse or a CNA, just consider us. Consider us. You'll be outside those 4 walls unless you're in the unit, but even then, it's a different environment. And take a chance, see what you think.
Thank you both for being here.
Thank you, Paige.
And thank you for watching Caldwell County Today.